So I'm Dr. Twito. I go by many nicknames, but Dr. Twito in the office. And I am a military spouse, and I've been in practice for 12 years. So I grew up like, I want to be a pediatrician. And then all of a sudden I hit my teens and I had like this extreme needle phobia where I wasn't thankfully dashing out of rooms, but I was just literally passing out with any just even thought of like, we're going to the doctor. Oh my gosh, I'm going to have to get a shot. And so then I thought, well, I can't be like pediatrician, like have this thing going on. And then I went to the University of San Francisco for undergrad. I volunteered. I was called the Mothers and Babies Project there through UCSF. And then writing down there was like in awe of the residents. So I think that kind of planted the seed of like, we should just keep this door open. It is so fun. I mean, in med school, they tell you, keep your mind open. You never know what you're gonna like walk into. You never know what you're gonna want. And I pretty much went in knowing like I want to work with kids, you know? And I grew up like, I think probably like a lot of us, like you babysit, you like being around kids, you're a camp counselor, like your whole resume was like kid oriented stuff, you know? And they're just fun. They go down fast, but they recover fast. You know, once you get into an adult, like you're trying to break bad habits, become a new human, but like you're kind of set in your ways, right? Like, let's be realistic about this. With kids, like you have that avenue, you have that opportunity to change the trajectory, help the trajectory, you know, hold a parent's hand. So it's just like, and people are trusting you. Like, you know, they trust you with their most treasured items. And to have that trust, it's like, it's a privilege. It's an honor. It's not something that you really should take for granted. Trying is succeeding. You're not going to get it all right. You're taking 5 steps forward and then you take 5 steps back. You know, you're just trying every day. You're showing up for your kid, and that one hug you get tells you you're doing a good job. But also, you're never not worried now, because, you know, once you have a child, you're always worried. And I joke around, if you're not worried, you're worried that you're not worried. So you just feel better. You feel like you're doing your parent due diligence if you are worried. And it's hard. And there's a lot of things. I'll say the book's going to tell you to do this, but the reality is that's not going to happen as a parent. You're not going to be able to keep a cold compress on a kid that's 2 months old, you know? So I like to bring a mix of like, these are the medical things I want you to know. So if you go on Google, you're not like, Dr. Twito didn't tell us that. But at the same time, these are the things that are probably going to be able to like happen in your house. Now you heard all the things that you hopefully wanted to hear. So I love working at Bluebird Kids Health. The behavioral health component, and then also because we're servicing the community, right? We're not screening out, we can't see this person or that person, or we're in a select niche that doesn't, you know, cater to this person. So doors are open. The community outreach is amazing. I've never worked for a company that is this like ingrained in all the things and trying to do more and more and more for kids. So every day it allows you to get to feel like a good human, because you got to go to work with good people that want to deliver quality care and give back. And like, that's what you want to do as a pediatrician. You're a giver.